Welcome to another episode of Judgment Date. Particularly delighted to welcome the head of the Department of Health in the Western Cape, Dr. Cloete, to talk to me. Obviously, the issue of vaccines in particular, the possibility of the third wave in general, are vexing the minds of all of us at this particular moment. And as you know, those of you who've watched our programs, we have concentrated in the main on the effects of COVID, medical, ethical, legal, economic. And we're back, in a sense, to the real nitty-gritty stuff this afternoon. And I'm very grateful, Keith, that you've joined us. Can I just start by asking you, where are we with regard to third waves?
Good afternoon, Dennis, and it's really a pleasure to join you. The country, you would have noticed, the country has made an official announcement that in 2 of our provinces, we're now officially in the third wave. So we are in the Free State, and in the Northern Cape, we're officially in the third wave. That's the National Institute for Communicable Disease that is monitoring the state of cases, hospitalizations, and death across the country. And on the basis of the recent cases, there's a confirmation that we're in the third wave in those 2 provinces. For the rest of us, the other 7 provinces are on high alert, and we are monitoring on a daily basis how many cases we have, what's happening with the cases. And in our province, we have a very, very strict surveillance system to pick up any little clusters, any connected cases, and we're monitoring that, basically on an ongoing basis.
And where are we here? Where are we in the Western Cape?
As a Western Cape, at this point in time, we're still having about 120 cases per day only. So we're solidly between waves. 120 cases, about 25 admissions a day, and 3 deaths a day. That is a very solid plateau position where we find ourselves in between waves. At this point in time, there are some small markers that we might be seeing an increase, but we're watching that very carefully. And that's specifically in the Cape Town metro. And our concern is tests that's been sent to private sector laboratories in the Cape Town. And it points to a vulnerability that we've known is there. And that is a vulnerability in the more affluent neighborhoods and suburbs in Cape Town. And there's a sign that of the tests we're sending to the laboratory, which is proportion positive, that is starting to creep up slowly in especially private sector testing in certain of the suburbs in Cape Town.
And that's because when we had the second wave, is that because townships and others got far more attacked by the virus than the middle class areas?
Yes, so cumulatively from the first and second wave, the township areas and the socioeconomically more deprived areas, the prevalence of infection in those areas were much higher than in affluent suburbs.
So looking at the Western Cape and perhaps some of the other provinces, it's inevitable, I would imagine, that at some point there is going to be a significant uptick. Or am I wrong? Is it possible that it could escape?
There is this modeling consortium, a very respected group of organizations, Masher at UCT, the people at Stellenbosch, the people at WITS, together with NICD. This consortium has put together scenarios for the whole country, for all 9 provinces. The big thing that they do say in there, they take all of this into consideration. They take into consideration the variant, and we'll probably come back to that discussion about variants. And then they take into consideration immunity from previous attacks, waves, and then seasonal variation. But the big factor is behavior. So their modeling points out that if we can manage to wear masks, to keep our distance, to keep small gatherings, and when necessary, actually cut back on gatherings, keep outdoors as far as possible, there is a very strong chance that we can impact on A, the onset of the third wave, and B, the size and the impact of the third wave. And that opens the door for us to be able to vaccinate enough people, because there's now a balance that we have to get into that.
I appreciate that. And that's why I did want to come to the vaccine. So tell me this. Let me preface my question by making a remark. And this is not aimed at you at all, because I've listened carefully to what you said over a long time, and you've been very honest with the public. But I'm afraid the politicians across the country haven't been. The truth about it is that people have been told all sorts of manner of things. And there's a great deal of uncertainty now as to precisely what is going to happen. My understanding, correct me if I'm wrong, is from the 17th of this month, you're going to be commencing nationwide, but this province as well, the Western Cape, a rollout. Is that the second segment of the broad rollout? Am I right?
17th of May, we're officially starting vaccinating people over the age of 60. That is the first group of people of what we call is phase 2 vaccination for the country. Phase 1, you know, is healthcare workers. We're busy finalizing the vaccination program for healthcare workers. And on the 17th of May, we start with the vaccination officially of people over the age of 60, which heralds the start of phase 2 of vaccination.
So let me just test a few propositions with you on this. Have all the healthcare workers in the province been vaccinated? Because in the country, or let me say it this way, in the country, as I understand it, there was we were told there were 1.5 million of these people. We know we haven't done more than 250, 300,000. So what's happened to these 1.2 million? And are there ones in the Western Cape within that cohort as well? There must be.
Okay, so let me put the figures into context for you in the Western Cape.
Yes, please.
Firstly, when we started this program, we worked on, and you know, we have public health specialists. We look at all the registration. We look at all the workplaces. So we always work that there's 134 healthcare workers, 134,000 healthcare workers in this province. To date, as of today, we have now vaccinated more than 65,000 of those healthcare workers. So we are, according to our definition, over 50%. Now, what we are busy doing at the moment is we verifying of that 134,000 healthcare workers, because your actual measure of whether you have that amount of healthcare workers is how many people that's in those category actually is registered on the system. So at this point in time, there's been a few hitches, you would pick that up in terms of registration. So we are getting access to that level of the EVDS. We're now getting access to individual, let's call it data points on that people that's registered. We will go through a process of verifying of every single person that has registered on the system, is there duplicates or whatever. What is the actual number of healthcare workers that's registered in this province? What is the balance that needs to be vaccinated before the 15th of May? We might go over a little bit over that, but we will, in our province, be very clear. The 64,000 healthcare workers that's been vaccinated, I can tell you there's about 6 categories of healthcare workers. Now, the one category is people working for our department. That is 53, we have in our employ as a provincial healthcare department, 35,000 workers. Now, 35,000 workers, I can give you a guarantee at this point in time, more than 70% of the people working for the Western Cape Department of Health has been vaccinated. That's in excess of 70%. But we're not the only healthcare workers. What we're now doing is, for instance, the city of Cape Town is a very important employer of healthcare workers. We're verifying their numbers and we're checking against them. Then there are people that is community health workers that works for NPOs. We're busy verifying everyone. Then there is undertakers. We're verifying all the undertakers. Then there are people that are traditional healers. Now, that's a bit of a tricky area, but we are verifying all the potential traditional healers we know of in this province. Then comes the big category of there are other healthcare workers that work in other settings other than our department. So we have the education department, we have the social development department. There are people that are care workers in old age homes. We got a very clear point that we have all of those. Then is the private sector. Now, in the private sector, it's also a complex array of different people. There's people who work in hospitals. There's people who work in private GP practices, then pharmacies, then an array of people that work in different settings. It become to our attention that we now need to go and figure out exactly where all these people are. If they are on the system, that we bring them into the system to be vaccinated. So it's a long answer, but we are pretty sure there's about 134,000 people in this province. We have exceeded the 60,000. The balance is what we need to do in the next 2 or 3 weeks. And we're in the process of verifying exactly who those people are so that we can come to a point. Yeah.
So here's my question. Let's assume that they all be verified. That would still be about another 65, almost 70,000 more. Now, that strictly, you've got to do them before you get on to people like me, the older category, if I could put it that way. And what I'm asking is, how on earth have you got the supply at this point to, over the next week or two, to vaccinate all of that cohort, those 60 or 70,000? Is there enough vaccine in the province at this point?
Yeah, so what we have is we have the Johnson & Johnson Sisonke vaccines, which is, from the research.
Yes.
We have 90,000 of those vaccines. We've done 66, so we got another 30,000 left. We are just been told, we are very grateful to accept, there's some additional doses that will come to the Western Cape. So we are probably going to get another 4,000 or 5,000 doses. That takes us to 95,000. Then what you would have noticed is that the Pfizer vaccines did arrive.
Yes, 325,000.
Yeah, we're getting 34,000 of that on the 15th of May. So what we need to do is we need to balance from where we need to complete out of the Johnson & Johnson vaccine, the 90,000, together with the 30,000 coming in, that whatever is left over and there's a balance, we will do some healthcare workers. So therefore, when we start on the 17th of May, we're starting on Pfizer vaccines for people in old age homes and for the elderly.
But where will you get that, Keith? Yeah. Sorry, the arithmetic doesn't add up. Yeah. If you take the Pfizer and you take the Johnson that you're talking about, that may cover your 70,000. Where's the additional coming from?
Now, let me explain to you. We already have 90,000 doses, right?
Oh, you're telling me you've got 90 in the moment?
Already. We have already.
Okay. So then you will have
another 30,000 that we must use.
Okay. So you will
we'll get to about 95,000.
Yeah. Okay. So call me a liar. If you've got 25,000, if you vaccinate all the healthcare workers, you then still got roughly 25,000 of that left over, and you've got another 30,000 Pfizer. Would I be right?
Yeah. You're more or less
there. That's why you're saying that as at the 17th, you should have roughly 50 or 60,000, which would be available to that cohort of comorbidities and older than 60.
Let me make it very clear to you. So there is, like you say, from the calculation, we will not have a full. We will have 30,000 of the Pfizer that has arrived, right?
Yes.
So that out of that, we probably will have about 20,000 that we will be able to do for the over 60s. That's more or less where we're sitting. Now that 20,000 would be Pfizer doses, and Pfizer is going to be a first and a second dose. But we will be able to start on the 17th with about 20,000 for people over the age.
So you'll have 20,000 vaccines, and presumably you're hoping that the government will distribute what? Another, because I understand that until the end of May, it's 325 a week.
Okay, so what we will get is we get on the 14th, the 34,000 doses I'm talking about.
And then you'll get on the 21st.
Every week from that day, every 7 days, we get 34,000 doses.
So let us say that.
But let me just explain, Dennis, that on
please do.
Yeah. On the 28th of May, we get something like 200,000 doses of Johnson & Johnson. So it's 34,000 on the 14th, 34,000 on the 21st, 34,000 on the 28th, and on the 28th, an additional 200,000 doses of Johnson & Johnson.
All right, but okay, so we've discussed, and I think we can settle on that. My listeners will be satisfied to know that by the end of May already, you've got a very significant amount of supply to start unrolling it for the purposes of the over 60s. So let's call it distribution. So you take somebody like myself. I have registered. Now, all I've got. Now we are, my calculations, now on the 7th of May. That's 10 days away.
Yes.
When are you going to know, when are people going to know, one, where they've got to go to? Where are the facilities which are actually organized at this point? And where are the people who are going to be vaccinating us?
Yes. So let me put it to you this way. I liken it to there's different moving parts and they come together. And it's a little bit unfortunate because me sitting in the system, I can see the moving parts coming together. It's difficult to explain to everybody, a member of the public, if you bring all those moving parts together, how is it going to hit you and where you are? But let me put it to you this way. I answered this to 3 people yesterday that sent me an WhatsApp and sent me an email.
Okay.
So this is the answer I gave. If you have registered after the 16th of April, after 4 o'clock, and you got a SMS to confirm that you're on the system, you are one of the 180,000 people over the age of 60 in this province that's currently on the system. Now,
that's only 24. That's 24%. Is that right?
That's 24%. That's 24%.
We'll come back to that. We'll come back. Let's park that. Yeah. Okay, carry on.
So you're one of the 24%. What will happen over the next 10 to 14 days, right, is we will come back to you with a follow-up SMS to say, you have now been assigned to site X, and your date to be there is this time, and sorry, this date and that time. So that is what we need to come. So you asking me, what are all the bits and pieces must come together for me to be able to send that, for you to receive that?
Yes, you've got to have the sites ready, you've got to have the vaccinators ready, etc. And the computer system. Yeah.
Yes. So on the computer system, we have the system, we have access to the system. It is working now in our setting. The second thing is the sites from the public sector perspective. We have identified more than 200 sites across the province, right? So every geographic area has got what we call the base of the vaccination sites. The site has been procured, the sites are being prepared. And remember, we are currently vaccinating healthcare workers at some of these sites. So we already have the systems, the queues, how you come in. I myself personally only got vaccinated 6 days ago because I'm an office worker and the frontline people had to go.
Good on you that you stood back for others. Carry on.
Yeah. So the point is, when I went in there, I got my SMS and it said to me, be there 10 o'clock. I arrived, I went in. It took me, what was it, maybe an hour. And I was out, I was observed. I left with a card. So that system, we know what that system looks like and it will be ready. Now we have public sector sites across this entire province. That will be the basic sites. In addition to those sites, we will have what is called private sector sites. Now the majority of those private sector sites that we're currently putting together with the public sector sites are going to be retail pharmacies and community pharmacies. That's the majority. There's going to be a few GP practices and 1 or 2 hospitals. So we're putting that together. In addition to that, we will be confirming probably in this province 1 mass site. And that will be probably in the metro area. And we will make that announcement in the next week or so. And then after that, there's one other group of sites. And that is what we would call workplace vaccination sites. So there will be big retailers or people that actually have work employers, and they will have a vaccination site inside themselves. So what we're doing at the moment, Dennis, is we're bringing all of those parts together in each geographic location. And we have more than 2,000 vaccinators that's already been trained, ready to be deployed across these sites with all the stuff that needs to be in the site. The computers, the iPads to be able to check when somebody arrives and all of those. What we now need to do is, because we have access to this the system, is to be able to plug all of those pieces into the system to be able to say, on Dennis Davis will receive a SMS to say that his site, in terms of where he lives, is a kilometer down the road from where he is. He has to be at that place on the 22nd of May at 10 o'clock in the morning. And that is what we now busy work to put all of those pieces together.
Are you telling me though, Keith, that between now and we've only got 10 days, and if you take 2 weekends out of that, that's 4, you've basically got 6 business days to actually get those sites up and ready, so that on the 17th, people are going to get a ping on their cell phone, and they will know, well, they'll get it before the 17th, they're going to start on the 17th. They know that they've got to go to X site on the 17th.
Yeah. So let me put it to you this way, very, very clearly. Our first port of call probably now in this, and that's what we're going to be doing and communicating towards the end of next week, our first port of call from the 17th onward is actually probably to guarantee for people in certain designated old age homes that we will firstly do outreach to those places. So we will be kind of making that clear that we will go. We will definitely, and I'm basically saying to you, it will probably not take 6 days. It will be slightly longer. But we will definitely have some people on the 17th contacted with a date. Okay. And I, for instance, know the date that's, the one place where we're going to be on the 17th. And I know they already are starting to say, how many people do you match up on the day? Who are the people living in close proximity? And who are the people that you're going to actually get on that place? So it is going to start on the 17th. It is not going to be all 760,000 people or whatever proportion has been on the system would have gotten the SMS by then. But the people that should be vaccinated on the 17th would have received it. So there will be an incremental, slow uptake. And as I said to you, towards the end of May, we have big amounts, and it will actually take its time to take off in there. So from where I'm sitting,
sorry, carry on.
From where I'm sitting, let me put it to you this way: there will be people over the age of 60 that will get SMSs. Not all of you that will get SMSs before the 17th, because on the 17th there will be people reporting to some sites. Not the big volumes, maybe a startup sites. And then there will be definitely on the 17th that our teams will go out to designated old age homes to start vaccination in the old age homes. And remember, that's the 20,000 that we have to be able to start with. And then the week after, another 34.
Then you've got another 34. And then you tell me at the end of the month there's over 200.
Yeah.
So, and how many are in the, how many have you, the sign up is what, 100,000, is that right?
So it's 180,000 as of yesterday. So it's 2 days ago. So it's 22%. Again, because we have access to the system now, we can pinpoint it. So we say it's only a 7% uptake in Central Karoo. That worries us. But it's a 40% uptake in Overberg. So in Overberg, there's 40% of the people over 60 has already signed up. In the metro, it's about 22%. Yeah.
Well, that's the point. What about all those people who don't have cell phones? People who speak isiXhosa and can't speak English? Now, what's happening to them?
Okay, so the mobilization over the next 10 days is specifically to answer that specific question. So we have community health workers. You would be aware of them. It's about 3,000. They deployed in every local community. We are working with all the sectors. We're approaching the schools. We're bringing the materials. So two things have happened. The first one is that the registration on the system can now be done through the USSD functionality, and it can also be done via WhatsApp. So this issue about having internet connectivity is not something that actually would then be so a WhatsApp registration would be a much easier way to do it. The second thing is deploying people in the geographic areas to go into the places to actually get the numbers up. The third thing is we now have the system to track on a daily basis. Are the numbers picking up in each of the areas and deploy specifically targeted intervention in each of them. The city of Cape Town is working with us. All the municipalities are working with us. As I said, school kids are going to be working with us. Neighborhood watchers are going to be working with us. Our community health workers. So there's a big drive. Because remember, the 180,000 is basically voluntary registration. What we now will be doing is people going to assist. There's another thing that we will be doing, which will bring that quite big up, is that the system, we're asking the national guys that's working with the system to give us the functionality to upload block registration. So we want to go to a old age home and take the 60 residents and upload them as one. We want to, that's one of the things. So all of those, Dennis, obviously our target is to up this 180,000 registers out of 750,000 to get that.
Keith, can I just stop you there? Is it 750,000 who are in that cohort of over 60 and the comorbidity people?
No. Let me just put it to you clear.
Yeah, tell me,
Yeah. So just the clarity on this specific issue, the international experience, and it's experience that's been replicated. We've learned a lot and we've heard from other countries. Sure. The international experience is that age is the simplest and the best administrative way to do it. So we're purely going according to age at this point in time. And remember also our data, we've got very rich data from the COVID that says the biggest risk factor for people contracting COVID, and not just contracting COVID, but the more severe form of COVID, that will result in hospitalization and death is age. That's the big thing. So if we go to people over the age of 60, they're the most likely to get severe form. And that, when I'm saying 750,000, is 750,000 in this province over the age of 60.
Okay.
After that,
your aim is to get the 750,000 of old toppies, as it were, like me, actually done.
That's it.
And
before the end of July. Yeah, that's the aim.
Is that? Well, yes, I was going to ask you that, because I was just looking at your figures then. It would have to be a couple of months. It'll take you a couple of months.
2 months, yeah. So end of July. Because remember, I said to you now, 30,000 Pfizer, 30,000 Pfizer, then all of a sudden 216,000 Johnson & Johnson. And then we go into June, it goes up, and into July. July, the numbers really go up. So it's an incremental availability of vaccines. Our ability to be able to get to the end of July is dependent on our ability to bring on sites and capacity to incrementally, on a daily basis, increase our daily quantum of people to be vaccinated.
You're going to have to eventually vaccinate more than 10,000 people a day.
Our aim is to get to 26,000 a day.
That's an enormous amount. We've never done anything like that before. Why do you think that we can do that?
It's a combination of two things. Firstly, we've got about 3,000 vaccines a day in this province at 9 sites. Remember, what we've done for healthcare work has only been at 9 sites. Yes. If you take the 9 sites and you make the 9 sites 300 sites, 400 sites. So it's the volume of the number of sites. And what you then have to do at each site, it is what we've worked out to be able to do. So to be able to do 26,000, for instance, we need to be able to do about 18,000, 19,000 in the metro alone. That's why we need this mass vaccination site that could do up to about 2,000 to 5,000 people in one day at that site, together with large sites. And that's the figures that we've worked out. So our quantum of how many sites we need, what the throughput at the sites is that you require, plus the vaccinator and the administrator teams, plus all the support things that you need, has been put in place to achieve a target of 26,000 per day.
Which is where you'll finally get to.
We will get to that.
Okay, so let me ask you this then. In the first part, is this not going to privilege the wealthier people, people on medical aids and wealthier people?
Yeah, so the point is, Dennis, what we're doing, we are really stressing this as let's put it this way. It is a ethical and moral imperative that the vaccine should be available and accessible for people irrespective.
I agree.
Of their income level, their level of privilege, their level of access to resources. So and that's why the first aim of people that we put down the sites that I'm talking about, which is public sector sites, is it's basically to meet the needs of the people that do not have medical insurance and privilege. Are the medical insurance people going to private sites then? Well, the point is you're going to go to a combination. So primarily medical aid patients are going to be assigned to a private site, right? Primarily. But if there is a public sector site in that area, the volumes make sense, you will be taken to the public sector. But you say when you talk about private sites, private sites, sorry, yeah. You're talking about the private sites would be in the main these large chains like Clicks and Dis-Chem, or not? It will be in the main then. There's some independent pharmacies as well. There's over 217 pharmacy sites that we're entering into the system. We're also working with our private colleagues to say that there's about 400 private old age homes that we're also working with them. So are they getting their act together as well at the moment? Because when I go into these stores, there's nothing happening there. Are they, I mean, at some point, surely they're going to have an entrance and exit, all of that sort of stuff. I'll be very honest with you, Dennis. When I say the moving part that I am the most secure about and the more confident about is the public sector sites. Now, that is very counterintuitive, Keith. Exactly. Tell me the private sector is efficient. So how are you going to persuade the private sector then? What are you doing with them? So what we have done is, and you can understand a little bit. I mean, if you've tracked where the sites were for the, I don't know if you've tracked it for the healthcare workers, you would have noticed that the sites where the most vaccinations were done was Grootske and Tygerberg Hospital, public sector sites. If actually, when we started off, many of the private healthcare workers had to go queue on a Saturday and a Sunday to get their vaccinations at the public sector sites. That is just the way that it actually unfolded. There is a Gatesville site, and there is now private sector there. But if you go into rural areas, it's all public sector sites.
Public sector.
And all healthcare workers, whether they are public or private, are getting it at public sector sites. So the experience of setting up vaccination sites is very much with us at this point in time as public sector. And that's why I'm saying to you, I am secure and I'm very confident about the public sector sites that will be operational on the 17th of May. What we've done with the private sector, though, is our private sector colleagues have been working and they're trying to do this for the whole country. So I have to also admire them for that, because with the national department, you have to get this very, very clear. And Business for South Africa, B4SA, has worked very closely with the national department. What we have told our national colleagues is say, guys, we're ready. Please, we want to talk to our counterparts in the province because the time is getting short. We need to align this thing and we need to know what the pharmacy site in, I'm not sure which neighborhood you live, but we need to know what that pharmacy site looks like, what the system is, how the throughput is, because we need to get to that level of technical operational detail. So in this past week, on last Monday, we had a combination of all the private sector organizers, plus the public sector, plus the workplaces, and our teams are now busy mapping that out per geographic area. So we're mapping out the private sector sites.
So they too will be ready by the 17th.
We want to work with them. Remember, they are going to also start doing some healthcare worker vaccinations beyond Sisonke. So they are also setting themselves up, but we are working with them to be also ready by the 17th. But like you say, it's not going to be, I mean, what we are actually saying, and we want to really come out and be very clear with everybody. Like you say, we can't not tell people exactly.
No, you've been very clear, I can assure you.
And we want to come and say, maybe there will be 200 private sites in the province, but on the 17th, we have prioritized the following 35. You know, so we will start like that and incrementally we'll work to the 200. So we will be very clear, Dennis. We will come out and we will make that very clear and public to everyone.
And when is this going to happen? When will we know?
We only have to do it within the next week to 10 days. We have to.
I know, but that's not a long way.
It's not a long way, yeah.
So are you telling me that in the next 10 days, I will know, and people in this province at least, we can't talk about the whole country, will know exactly that there are these X sites in which, not necessarily they'll go, but those will be the sites.
Yes, so you can imagine, Dennis, I would have, the only way if I'm confident to say that's going to happen, I've already seen the sites and I've been to some of them and seen.
Okay, I'm not asking you further. I'm just, I'll ask you back if there's a problem, but that's another. Can I ask you a final question?
So let me put it to you, Dennis, yes. Let me put it to you very clear. What we will do is we will clearly articulate to people per geographic area. By the 17th, these are the sites that will be operational in your geographic area. Okay,
got you. And therefore, I'm assuming that for a small group of people, not many, because I understand it's be gradual, some people should be getting an SMS if they're lucky before the 17th.
That is the plan.
Okay, all right. One final question. You've been incredibly gracious with your time, because I know that there are people who watch this program all over the country, but the Western Cape seems to have been perhaps the most organized of all the provinces as regarding at least to a case study for the rest of the country. But the one question I did want to ask you, which again goes to the whole country, which takes us back to the beginning. Are you worried that these these variants that keep on cropping up may well subvert your program because some of this vaccine may not be appropriate there too?
That's a very good question, Dennis. And the answer is, I'll give you the simplest answer. I hope not to sound like a politician or a complicated scientist.
So, if you sounded like a politician, I wouldn't have got all this detail.
So let me put it to you this way. The scientist talks about two categories of variants. The first one they called a VOC, a variant of concern. And then they talk about a VOI, a variant of interest. Now, the variant of concern are the ones that has been proven to be either more infectious, so it causes more infections, or it is more pathogenic, that means it causes more severe disease. So the 4 variants of concern that we have so far, and actually the one that was now registered in India, the latest one, it must still be determined whether it is of concern or of interest because it's so recent. But you would know, and it's very well publicized, that the variant B1351, which is the one that was detected in Nelson Mandela Bay, that one has become the first variant of concern for the globe. And you can imagine by now that variant is in many multiple countries across the globe. The second one that because of concern was B117. That was the one in the UK. And you know that that one has been proven to be more infectious, but also possibly cause a more severe form of disease. Then there was a third one, which was called P1. And that is the one that was in Brazil. Now, what we do, and now there's B1617, which is the one that was detected in India. So what has happened currently is our scientists, and I really need to make a plug for our scientists here.
They've been brilliant.
They've been brilliant, and they've been world-class. They actually led the world in relation to...
No question.
Yeah. And they are a network of scientists, including scientists in the Western Cape that's connected to that network. So we have scientists working at the Tygerberg Laboratory and at the Cloete Laboratory that are almost routinely doing this genotyping of the various viruses. The overwhelming feeling of these scientists at the moment, Dennis, is the following. That the one that we have, which is our predominant one, B1351, because of the number of mutations it has, it is a very dominant strain, and it's become the dominant strain in South Africa. They've seen nothing in the other variants to suggest that any variant of concern at this point in time will replace that as the most dominant strain in our city.
Okay.
So even if these other ones come in, I mean, somebody asked us a couple of, they say, have you ever detected a UK strain here or the B117? And we said, yes, we did pick it up 2 or 3 months ago, but it's not shown to be competing with the prevalent one here, and it's not taken off in a big way. We've not picked up anyone from the P1 from the Brazil. And what they're testing in KZN now at this point in time is to see whether anybody that's come from the India actually has this new strain, because it's not been confirmed yet. But even if we confirm it, it's not likely that it will become the dominant strain anytime soon. So therefore, our third wave predictions is working on a clear scientific assumption that our prevailing dominant strain remains the one we had in the second wave, which is to which we have already the seroprevalence, some protection, all of those things.
One final question, Keith. A lot of lay people are going to, you can just imagine, I'm sure the doctors are going to be inundated with this. Should I have the Pfizer vaccine or the Johnson & Johnson vaccine? I mean, there's not really much difference, is there? I mean, we've got relatively good figures for both of them.
So actually, the kind of irony is that we have very good figures for Johnson & Johnson, because by the time they did their trials in South Africa, it was the last one. And they did their trials in January while people had the variant 351. So it is the one vaccine that's been tested in people as part of its trial that contracted the variant that is currently the prevailing variant. And that's where we got the good results from that suggested it should be used instead of the Covishield, which was the AstraZeneca.
I understand that, but now what about the Pfizer vaccine?
So the Pfizer vaccine, there's been some laboratory studies to suggest that there's nothing to suggest in the Pfizer vaccine that it will not be effective against the variant here. So therefore, using a combination of Pfizer and Johnson & Johnson is very safe. The information about its effectiveness is very equal. And the information about its side effects is what you would expect normally. So we have a clinical advisory committee, a very expert advisory committee in this province. We're very fortunate to have a lot of good scientists and experts here. So that advice, same to the Ministerial Advisory Committee that's chaired by Professor Shuru, is that we should offer Johnson & Johnson and Pfizer interchangeably at point of vaccine, and there should not be a choice for the person presenting, because scientifically it is neither here nor there. Actually, in certain instances, it's probably preferable that you take Johnson & Johnson because it's only a single dose. And for Pfizer, you have to come back a second time.
And will there be any distinction between Johnson & Johnson in rural areas and Pfizer in urban because of the refrigeration or not so?
In this province, again, I can't speak for other provinces. We have the Stellenbosch University has got -70 refrigeration storage facility. So we can store Pfizer vaccines for as long as we want in that facility. We've got big volume. But also what we're doing is we're hiring a courier service that can offer us to transport vaccines at -70 to another site. So theoretically, we have a truck that will make it almost the same, whether you are in Bellville or in Gugulethu and you get Pfizer, it makes it the same whether you are in George, potentially, or in Paul, or in a rural town. So our system is in place to be able to get Pfizer to as many places as possible. There's a logistics issue about Pfizer, which is once you open it, you got 6 hours. So it is preferable for high volume sites. Whereas Johnson & Johnson lends itself better if you have small volume sites in terms of. So that goes into the rural extension of ruralness and dispersed facilities, not from the actual vaccine itself, if you understand from that perspective.
No, I do. And I've run out of time, Keith. So let me say in thanking you, you've been very generous but accurate in your compliments to the virology community in South Africa. I too have interviewed many of them and been incredibly impressed. In fact, just incredibly proud that we've got the kind of expertise, as you say, world class. But let me say this to you. I think the province is really lucky to have you running the show here. And I really mean that. And all I can say is, if you got it wrong, well, we'll have you back and we can have another conversation. But on that basis, I hope I never see you again. But but I do want to say, perhaps we will in any event, just to reflect on it as time goes on. But thank you so much and good luck. We all need it as we roll this out on the 17th. Thanks a lot.
But thank you very much, Dennis, for how you do this and what you do. It's very important that we do have these channels and voices like yours. Thank you very much for what you do.
Pleasure. Pleasure.